Talk Live. It is your show, and you can bring up whatever you want via the toll-free number at 800-259-9231, SACL's CAI toll-free line. It's Ian here with you.
And Wayne.
And Mark.
Join us online at freetalklive.com and enjoy the features on the site for free. While you're doing that, consider supporting the program by going and shopping at amazon.freetalklive.com. Enter Amazon through that link. Free Talk Live gets a cut of your purchase. It's the same price whether you enter through their normal link or through amazon.freetalklive.com. So there's no increase in prices. Same great deals. Super Saver shipping available on many of their items for free. So once again, go to amazon.freetalklive.com to get everything you need for the holiday season and everything else you need in life. 41 categories, used and new. We get a cut if you enter through amazon.freetalklive.com.
The New Hampshire Liberty Forum has a proud history of supporting true, hard currency. At the first forum, Dr. Ron Paul called for the restoration of constitutional gold and silver. This January, Bernard von Nothaus, monetary architect of the Liberty Dollar, will be a distinguished speaker. That's assuming he hasn't been picked up by the FBI at that point. Register now at the freestateproject.org/libertyforum. That's freestateproject.org/libertyforum. Use code 2008FTL to save 10%. 2008FTL. freestateproject.org/libertyforum.
We are talking about the Canadian healthcare system and just also the British healthcare system as well. The idea of socialized medicine. It's something that's gaining popularity here in America. No thanks, I'm sure, to many of the government schools or socialist indoctrination camps, as one might call them. Sort of putting this into people's heads, and all of the presidential candidates out there on both sides, Republican and Democrat, both proposing more government control for health care. And this is not a healthy direction that we need to be going in. And Jim Babka at downsizedc.org is pointing out some interesting statistics as to why. We've already given you some anecdotal stories about just the abject failures of this system, where people, because they have to wait so long to get their so-called free health care, that they perish. They die, or their disease gets so bad in the time frame that they have to wait that there's no point in even treating it anymore. So there's plenty of anecdotes, but there's also statistics that show that in 2001, for instance, here are some interesting percentages as to how many people had to wait more than a third of a year, 4 months, for surgery. The answer is 36% of patients in Britain's fully socialized system, 27% of patients in Canada's fully socialized system, 26% in New Zealand's socialized system, and 23% in Australia's socialized system, and in America's half-socialized system, where government spends about half of the dollars in the healthcare system, 5%.
Less than half. I would expect it, if it was 20% and 20+% in those countries.
You thought maybe 10%.
10%.
Yeah.
But
5%.
Apparently it's exponential.
So what a difference that just half as much socialism can make. If the statistics show that the fully socialized systems to be so much worse than America's half-socialized system, isn't it at least worth considering that we might solve many of America's remaining healthcare problems by going even more in the direction of the free market? Mm-hmm. These are just a few snapshots of what the statistical studies show in comparison to mere anecdotes, and there are many more such studies tending strongly toward the same conclusion, and that is that there ain't no such thing as a free lunch. Tannstafel, as it is called for short. That's the acronym there. It's a pithy way of saying that if you don't pay a real free market price for health care, supply will fall short of demand. And so you'll end up paying in another way, with waiting lists that could kill you.
Not to mention the fact that likely we'll pay significantly more per person because government is inefficient every single time.
Well, you know what really aggravates me? The proponents of socialized medicine always say, oh, the for-profit medicine is bad and the capitalistic system of medicine is bad. Well, we don't have a capitalistic free market system in medicine. We have a corporatist, socialist hybrid form of medicine. The only place you really have something close to a free market in medicine is elective surgery, like LASIK surgery, like plastic surgery, where you have a direct doctor-patient relationship where you can shop for the best price, the best doctor.
Patients are paying cash and prices come down and service gets better.
Yep.
It's so true. Also, and there are other areas where it's more competitive. Veterinarians, for instance, not as regulated, not as socialized, so there's a lot of competition there. Dentists aren't as in a bad of shape as the rest of the medical world. So again, prices tend to be a little more reasonable. There's a lot more competition, and customers are always free to jump around to whoever's offering the best services
and ask how much it is. Right. In a socialized medical system, or even a corporatized, the doctors really don't know how much things cost. They just go in each room and do their thing, go to the next room, and they have no idea.
They don't know now what things cost. My wife is pregnant, as you know, and we go to the hospital and we've talked to the ladies in the room that are going to help my wife have a baby and all that stuff, and they don't have a clue what things cost. They just don't know. I mean, and that's the problem with the insurance system that we currently have.
Yeah, it shields people from that.
People are shielded from it. And I think that you want to solve the healthcare problem is, get people more in touch with their own health care and the costs thereof.
Yeah, but that's not what government wants to do. Government wants to take away responsibility from your life. Government wants to make all the decisions for you.
Now,
Government
I'm not saying that insurance
mandate...
shouldn't exist, but I think that insurance, would likely be best for people at a catastrophic level, and then they can pay for maintenance and the little things on their own.
Let's go to
the health savings accounts.
Let's go to the phones. We've got someone on the line in Canada. His name's oh no, we don't. He's in Ohio. But he wants to talk about it. Peter, you're on Free Talk
Canada,
Live.
Ohio.
Hey, Peter.
Hey, Peter. What's on your mind?
Hey, Ian, Mark, Wayne. Listen, I am in Ohio, but I am a Canadian studying in Ohio.
Okay.
So I just wanted to bring up a little fact that people might not know. On June 9th in 2005, the Canadian Supreme Court struck down the Quebec health insurance system as unconstitutional. So in Quebec, private for-profit health care is now legal.
Really?
And 3 of the 7 judges ruled that there was a federal Section 7 violation of the Charter of Rights and Freedoms in Canada. And the 4th judge, which would have made it a majority and so would have made Canada's healthcare system both private and public because of the court's ruling, he ruled that it wasn't a violation of the federal charter, except that the wording in the Quebec charter is, for all respects and purposes, just about identical to the federal charter. So he said he's only going to rule on the provincial charter rather than the federal charter. So
he capped it. He capped it at Quebec. The freedom is not able to expand out beyond Quebec for Canada.
Screw you, people in Saskatchewan.
Well, what he said actually is that this is just such a technicality. It's ridiculous when you think about it. But he said that the wording in the Quebec Charter of Rights and Freedoms is identical to the federal charter. So he implied that what he says about the Quebec Charter is going to apply to the federal charter. But because they have to stick to the letter of the law and not just the spirit in which he ruled, it applies to Quebec only right now. But there's a great organization, the Canadian Constitution Foundation, that is now in the middle of taking the Ontario government to court and the Alberta government to court. And look, I think Canada's healthcare system is changing dramatically.
Excellent.
Just as, here in the United States, Hillary Clinton care or, the appeal of Canada's healthcare system is going up. In Canada, people are beginning to think that our healthcare system, and by our I mean Canada's healthcare system, is not so good anymore.
Oh yeah, there are plenty of sick people in Canada that have already, certainly come down to America to have their treatments done. There's no doubt about that. What have you seen any evidence after you said this happened back in 2005? So it's been a year or two since then. Has anything changed significantly in Quebec? What is this new? What is the scene like with the private health care? Are people dramatically shifting over to it? Or have you heard anything?
I don't know if I would call it dramatic, but yeah. I mean, there's a number of different private clinics opening up in Quebec. There's a private clinic out in British Columbia. The guy who runs it, the one out in British Columbia, used to get into all kinds of trouble from politicians. Mm-hmm. But now they lay off. And he is now actually the president of the Canadian Medical Association, Dr. Brian Day.
Okay. There was another Dr. Ian that you had talked about a few months ago.
Yeah, I forget his name, though.
Yes, Dr. Chaoli or something like
Chaoli
that.
or something.
Yeah. Okay, so Dr. Jacques Chaoli is the fellow. The court case, the Supreme Court case, is called Chaoli versus Quebec.
Mm-hmm. Nice.
And Dr. Jacques Chaoli, who I've met a few times, and he was over at my house. He's the one who took it to the Supreme Court.
Wow.
And he's the one who won this case. And he's busy right now trying to get, more private medicine in Canada. Times are changing in Canada.
Good.
And we are moving in the free market direction. All of the arguments that you brought up, you quoted Jim Babka as well, all of those arguments were accepted by the Canadian Supreme Court.
Nice.
Excellent.
I imagine Canadians are sick and tired of putting up with this
nonsense,
this holy grail of socialized medicine that's supposed to save them all. They've seen it.
They've seen their family members dying and perishing.
They know that no government can effectively and efficiently implement any program, and in an area as important as medical care, they've realized that holy crap, we need to get the government out of this.